Hi guys! Today we're going to be talking about one specific disorder called schizophrenia. It can take a couple of different forms, but instead of looking at lots of different types of disorders like we did with anxiety, that all fall under the same category, we're just going to look at one, which is schizophrenia. The reason I like to do schizophrenia last is because it's often thought of as one of the most severe forms of mental illness, and it can be mild to severe, but its symptoms often have a very profound effect on the lives of the people that are dealing with it. So schizophrenia in itself, the word actually means split mind. And so a lot of times they confuse schizophrenia with multiple personalities because they think of the voices in the head as different people. But that's not actually true. So in multiple personalities, remember, they have to have two distinct personalities, where in schizophrenia, if they're hearing voices, the voices don't have personalities. They're just voices. They don't have names or backgrounds or any of those things. Okay, so what is schizophrenia, right? It's a severe disturbance in thinking, speech, perception, emotion, and behavior. Sometimes it's all of these, sometimes it's one or two. It depends on the individual client. The age of onset is actually adolescence, which I know sounds kind of scary because that's where a lot of you are, but in general, that's when schizophrenia starts to show its symptoms, 18 to 21. But a lot of times there are like some milder symptoms earlier on, and I'm going to show you a picture in a minute. There's weird hand movements that they find tend to be typical of people who develop schizophrenia later in life and in childhood. Nearly 2.5 million Americans are affected, and 1% of the world's population is affected. So schizophrenia is a disorder that is in every culture around the world. And recovery from schizophrenia is more rapid in developed nations because we tend to have medicine that other nations might not have access to give to clients with schizophrenia. So there's two basic types of symptoms that someone with schizophrenia will show, right? So you have the positive symptoms and the negative symptoms. Remember, in psychology, we don't say positive as in good and negative as in bad. Remember, positive, negative reinforcement? Positive is addition and negative in subtraction. So positive symptoms are symptoms that are in excess of normal functioning. They're added beyond what is normal, right? So an example of this is a delusion, right? A delusion is a false belief. So we all have beliefs, but the false beliefs, the CIA is out to get me. I am Jesus Christ. I'm rotting from a disease. The doctors are trying to kill me. That's an excess of the normal belief. It's a false belief. Then hallucinations are a false perception. And a lot of times we tend to think of hallucinations, we tend to think of seeing things, but actually the most common hallucination for someone with schizophrenia is auditory, right? Then you have speech disorganization, so they tend to have weird speech patterns, like they connect sentences in a way that sounds weird to someone who is on the outside of the conversation, and they can have odd movements or gestures. And I'll show you some pictures of that so you can kind of see what that means. The negative symptoms are a restriction or taking away from normal functioning. And two of the biggest things are the flat affect, which tends to a lack of motivation, and no motivation, no emotion, just very flat, right? And sometimes if they have any emotion, it's odd, like it's not the right one. It's like laughing when they should be sad and sad when it's kind of off. And then personal hygiene tends to also be reduced. So no showering, tattered clothes, they could lose control of their bladder, etc. And so this is a little bit of the hand movement that I was talking about in pre-schizophrenic children. They show this unusual posturing, hyperextension, while normal children tend to develop symmetrical movements. And it's not 100%, like if you see this, they will, but this woman, Elaine Walker, did studies and she found that there was a link there. So what are the basic types of schizophrenia? The first one is paranoid. Paranoid schizophrenia focuses mostly on the delusions, and it's really delusions of persecution. People are out to get you, or grandeur, like I'm on top of the world, I'm Jesus Christ, those kinds of things. And obviously paranoid in itself means that you're mostly worried that people are trying to hurt you, out to get you. And a lot of times it's like they're like ghosts or figures that are trying to hurt other people around you as well, not just yourself. This tends to occur a little bit later in life than adolescence, but doesn't have to. The next type of schizophrenia is disorganized, and the main features of this one are inappropriate behavior and emotion. So this is where they have the emotional states that are disconnected. They're really, really happy and laughing when they might be sad, or they're really, really sad when something might be happy. And they also use a language called word salad, or and they create words for other words, and those are called neologisms. So they actually like twist words around or have almost their own language. And here's an example of that, right? And the ideas kind of jump from back and forth from one to the next. So the intended sentence would be, sometimes it feels like, I'm here, sometimes it feels like someone has been pounding on my head with a hammer. But what comes out is, sometimes it feels and smells like someone has screwed a quarter-pound hamburger into my head and arms and legs, and if you shine a headlight inside it, it will drill you. Right? So it's like versions of that, but things tend to get kind of skewed in a way. The next type of schizophrenia is very rare. It's called catatonic schizophrenia, and this involves both frozen rigid movement, like you see in the picture over here, and excitable motor movement, kind of the complete opposite of this. And this rigid movement is actually called waxy flexibility. You can move the patient or the client around, and they don't like register that you are there. We don't know, obviously, if they know that you're not there or not from the inside, but from the outside, they show that they don't know you're there. You know, if you're in front of them, if you move them, it's like a wax figure almost. Here's another picture of that. And if you know anything about trying to hold your arm up like that, it's very hard. So obviously, there's something else going on here. And the last type is undifferentiated, and this is when you have a mixed set of symptoms. So basically you have multiple symptoms from different types, and they don't know which one to put you in, so they call it undifferentiated. There's also residual schizophrenia, which is the schizophrenia where you're in remission, or you are so in remission, which means that you're coming out, or the schizophrenia, you're recovering from it. So how do you get schizophrenia? The first one is genetics. So these are quadruplets. They were all diagnosed with the disorder, but one was hospitalized and one got married and had a kid. So it is genetics, but genetics isn't everything, right? Here's the breakdown of the population. You don't need to write this down, but you do need to know that identical twins have a higher rate of both having it than fraternal twins, which is how we know that there is genetic factors. One of the big things to focus on in schizophrenia is the dopamine hypothesis, right? Which is the idea that people with schizophrenia overutilize dopamine in their brain. They have too much. They either have too many dopamine receptors, right? And so the dopamine is more readily, used and sucked up from the opposite, from the postsynaptic. So, we have the presynaptic, right, releasing the dopamine, and then postsynaptic. Another is the brain abnormality. So you can see sometimes in a scan of someone with schizophrenia, large fluid-filled ventricles. If you look at the difference between this brain and this brain, you can kind of see the difference. And they also might have low activity in the frontal lobes, which a lot of time is related to the reality check. Additional risk factors: prenatal virus they have found some connections. Age of the father, they've found connections, and there is a connection between lower socioeconomic status and schizophrenia. But of course, it's a correlation. We don't know if schizophrenia causes people to not then be able to function, which makes them become homeless or poor, or being homeless or poor is so stressful that it triggers the schizophrenia. We don't know, right? So that's all for now, AP Psychos, and remember, psychology is flippin' awesome.